What is normal? Are these people normal? How would you know? With over 7 billion people on the planet, what is considered a normal person? What about the other side of the spectrum? What are abnormal people and what makes them different? Well, there are plenty of abnormal people on the planet who live normal lives. In fact, many of these people have what is known as mental illness. So what is mental illness?
I guess a mental illness is a disorder or collection of signs and symptoms that have largely to do with the functioning of the brain and seriously impair a person's ability to function in the normal spheres of life, whether it's school, work, family. There are several categories of mental illnesses. The ones that people tend to think of if they're referred for mental health help and they get anxious and upset and worried are the psychotic disorders, of which schizophrenia is the principal one. The most commonly experienced illnesses are the mood disorders, such as major depression and bipolar disorder that used to be called manic depressive illness, which is a condition where people can have just episodes of mania, which classically is the opposite of depression, as well as episodes of depression. The typical person tends to have more episodes of depression than they do of the natural high of mania or hypomania. Then there are the anxiety disorders, which is a wide variety of disorders that includes panic disorder, obsessive compulsive disorder, until recently included post-traumatic stress disorder, which now is sort of in its own category. There are also there is this distinction in our society between mental illness and substance use disorders, but certainly in the field of psychiatry, substance use disorders are another category of disorders, certainly in our diagnostic manual. And the take-home lesson on substance use disorders and the major psychiatric disorders is that many people, probably a majority of the people who have one of the others, meaning many of the people with major depression will also have a substance use disorder at some point in time, and vice versa.
As an attempt to cure mental illnesses, mental hospitals were created. The first people to attempt to cure the mentally ill were the Quakers. The Pennsylvania Hospital was founded in Philadelphia by Dr. Thomas Bond and Benjamin Franklin in 1751. The purpose of the hospital was to cure and house the sick, poor, and insane who wandered the streets of Philadelphia. Another institution created by the Quakers was known as the Asylum for the Relief of Persons Deprived of the Use of Their Reason, which opened on May 15, 1817. It was the first private mental health hospital and was later renamed to be the Friends Hospital, which still exists today. The first public mental institution was known as the Eastern State Hospital. It was constructed in 1773 and was located in Williamsburg, Virginia. Its construction was inspired by a speech given by Governor Francis Fauquier, who preached the importance of helping those in need. Over time, more and more mental hospitals were opened, like the Spring Grove Hospital Center in 1797.
Mental illness was originally thought as an untreatable condition, and people who had mental illness were often shunned, locked away, and separated from society for the rest of their lives. However, after the death of King George III, who died from a mental disorder, people in Britain became inspired to find a cure to mental illness. These ideas slowly made their way to America. One of the pioneers of American psychiatrics was Benjamin Rush. He introduced new methods to use in an attempt to cure mental illness. The beginning of mental illness treatments were far from humane. Patients were often abused and treated like animals.
So until the 1950s, there were no effective psychopharmacology. In other words, there were no drugs that really worked. So there's no such thing as antidepressants. There's no such thing as anti-anxiety drugs. There's no real treatment for schizophrenia or for bipolar disease. So what you have to imagine is these hospitals that you read about and the kind of chaos of them and the cruelty of them. A big part of that was that there was no effective treatment. And so people spent years there untreated, basically. And untreated psychoses are not pretty. And so part of this history of these big institutions with lots of very crazy people has partly to do with the institutions and partly to do with the fact that we had no good treatment. So people tried all kinds of things like electroshock and brain surgery and I mean, all these crazy things you think, what the hell did they think they were doing? And they used to do what were called baths, which were really just strapping people in tubs with cold water. I mean, it sounds completely loony today, but they didn't have a drug to use. They were trying anything they could think of to be able to manage patients and make them somewhat better.
Another important person to the early mental illness movement was Dorothea Dix. She was a school teacher who advocated for humane treatment for the mentally ill during the 1800s. No major reforms would occur until the 1950s when new drugs were created. Chlorpromazine, or more commonly known as Thorazine, was the first antipsychotic drug approved by the FDA and became a staple at mental institutions.
While mental hospitals were reforming their practices, there was still plenty of controversies surrounding them. Topeka State Hospital and Philadelphia State Hospital by Byberry were famous institutions that abused their patients and were eventually shut down due to their poor practices. Another well-known controversy about mental institutions was the Rosenhan experiment, led by David Rosenhan. He and 7 other people falsely admitted themselves into mental hospitals around the country. 7 of them were diagnosed with schizophrenia, and 1 was diagnosed with manic depressive psychosis. David Rosenhan concluded with the results of his experiment that mental hospitals couldn't tell the difference between the sane and the insane.
While there will always be a bad stigma with the words mental illness and mental institutions, in today's world, things are different. With progressive thinking and advances made to technology and medicine, newer and more efficient methods of treating the mentally ill have been used. The amount of time a person spends in a mental hospital has greatly reduced from a lifetime to at most a few weeks. In fact, over the past few years, more and more mental institutions have been closing. As a result of deinstitutionalization, more and more mentally ill patients are assimilating into society.
So there are a couple of studies that have actually closed state hospitals and followed the people into the community, and there were a lot of fears that you'd see suicide rates go up, or homicide rates, or greater homelessness, or greater incarceration, or poorer quality of life, because at least in this institution they have friends and they know people and they'll interact with people, and these folks are so sick that if they go out in the community, they'll just sit in their rooms all the time, or they'll do bad things. And the research suggests that in general, people do better out in the community. And the other thing is that living in the community with lots of supports, which some of these individuals do need lots of services and support, but it's still much cheaper than if they were still in institutions. Institutionalization, I think the number, it's like $150,000 a year to have somebody in a psychiatric institution, and maybe they could be effectively managed in the community for half that amount. So why not give people the opportunity to live in the community and probably have better outcomes at half the cost than putting people in institutions.
Today, there is a growing focus on mental health, but in terms of funding, there is a major deficit. Although, optimistically speaking, our mindset towards mental illnesses have moralized with time, but people are still afraid, and the topic of mental illness is still more or less a taboo, not only in American culture, but across the globe. It is hard to address a topic that people want to ignore and deem that it does not exist. But in order to treat mental illness, we first must acknowledge its existence and accept it. In order for people to seek treatment, they need to know that it is okay to not feel okay, and they should feel comfortable talking about it. The conversation starts with you. Start today. Salzer holds a more realistic prospect for the future of mental health.
And part of what happened during this period of deinstitutionalization is there was a belief that our culture should be more embracing and welcoming of people with difference, right? I would say what's happening now in our country is there's less of a belief in that. People are scared of difference, or more likely to be scared of difference. And there's also, especially the last few years, an increase in prejudice and discrimination towards people with mental illnesses. I actually think people, it's almost acceptable to think bad things about someone with schizophrenia. So every time there's a shooting, for example, or a mass shooting, we talk about people with serious mental illnesses being dangerous, and we need to control them and lock them up and force them to get treatment and all this kind of stuff. And at the same time, there's increasing talk of returning to institutions as the method for curing these people or fixing these people. And there are some individuals out there who are saying that the deinstitutionalization has actually been a bad thing, and it's caused all of these social problems in the country. And the way to fix our problems are to lock up people with serious mental illnesses. And there is a call for increasing the number of people who are in institutions, and I think that's reflective of our culture and where we are right now.
How the media portrays the mentally ill is absurd. They give people with mental illness an unjustified reputation. People will only remember the mentally ill as social rejects or abominations to mankind. However, it's just not true. Mentally ill people are no different than you and I.